do your own studies, or you don't do anything at all, the midterm will be easy, but the final will not. So I wouldn't worry too much about the midterm, and the final, I wouldn't worry much about it either because you're not gonna do well, unfortunately. Uh, but you can try your best, inshallah. You'll do good. Uh, the last thing I want to cover is that if I miss anything, I'm sorry. I tried my best to cover everything as much as possible. And be sure to do questions. Questions are the most important thing for the midterm. Go find a question bank and do as many as you can. I would say honestly, solve questions before studying the lectures at all. And that's it. That's my preamble. Let's start the crash course, inshallah. Everything goes well. So, first thing I want to talk about is the contents of the crash course. For the pre-midterm, we'll be covering introduction to infant development, infant social development, infant cognitive development, and early and late childhood development. So there's going to be a lot of focus on childhood, which is mainly what the course revolves around anyways. The organization of the session we will be talking about fetal development, not particularly in like an embryological standpoint, but more like biological. So don't worry about embryo. Then we'll have infancy and childhood, where we will talk about social development, cognitive development, and motor development. But we will also be talking about adulthood, same stuff. So introduction to fetal development, like we said. The first thing to note is that as a fetus, fetal development goes in a cephalocaudal direction. What does that mean? Cephalo means head, so you start with the head, and then you move on to the bottom part of your body. So it's in a cephalocaudal direction. So you start with the head, which means that your brain develops first. Because your brain develops first, what happens is as your other body parts develop, your brain develops more or faster, or because it was developing for much longer, your brain becomes big, like huge, like a balloon, like we saw in the previous picture. And there's a few problems with that we'll talk about in a bit. But this brain development starts at 18 days. Very important number to note. And it occupies a big portion of your brain, like we said. At 9 weeks, it's 25%. At 10 weeks, it's 90. I thought that was a question, sorry. When you're a newborn, it's 10%, and as an adult, it's 2%. Now, because this head is too big, it's too big to give birth to. So in order to make delivery viable, your brain kills off a part of itself in a process called pruning, and we're going to talk about it over here. First, I'd like to talk about the development of the brain. It starts off as a neural tube, and this neural tube closes and folds around 4th week, which is around 18 days, like we said. And as it folds, it develops into 3 main parts: the forebrain, the midbrain, and the hindbrain. Then the forebrain divides into the telencephalon and the diencephalon. On a micro level, the walls of the neural tube, they give rise to your neurons and the glial cell, and they continuously do this. It's a process called the proliferation stage, and they continuously do this from 10 weeks to 26 weeks. So by the end of the second trimester, the proliferation stage finishes, and you have the maximum amount of neurons that you could have. After that, you will have the process that I said was called pruning, which is where a bunch of neurons go through apoptosis to reduce the brain size and make birth viable by reducing the head size. On a cellular level, I mean, I don't know why it's different than micro level. Micro and cellular sounds the same, but like on a cellular level, you do have proliferation, but you also have migration of these neurons and glial cells from 4 to 9 months. So the neurons migrate to where they should be in the CNS in their proper places. And in no specific timeline, you have myelination and synaptogenesis. So the formation of synapses and myelin in order to conduct signals properly. If these are missing, you have a problem, obviously, and they are called gray or white matter syndromes. So far, the numbers we have are 4 weeks, your brain starts developing. At 18 days, your brain also starts developing, and 18 days is more accurate. So if a question comes up with 18 days, what happens? Your brain starts developing. 4 weeks is when the neural tube closes. 9 weeks, your brain is 25% of your body. 10 to 26 weeks, you have proliferation, like we said, 4 to 9 months, migration of the neurons. 10% of your brain, of your body is the brain as you when you're a newborn, and 2% as an adult. Now let us talk about the movement relations of a fetus. Okay, so there's quite a few, but I tried summarizing them. Um, the first thing is movement is not detected except by machinery, which is an ultrasound at 8 weeks. So there is movement of a fetus at 8 weeks, but it's only detected on ultrasound. Um, and the proper movements of a fetus happen at 10 weeks. So you have breathing, twitching of limbs, hand-face contact, stretching, and rotation. All of it happens at 10 weeks. Um, Easy way to remember when your mother starts feeling the movements is your ultrasound detects at 8 weeks. Everything, most movements are at 10 weeks, so 8 plus 10 is 18 weeks. So 18 weeks is when your mother starts to feel the movements of the fetus. The other extra movements are yawning at 11 weeks, sucking and swallowing at 12 weeks, and eye movements at 16 weeks. These are very important dates that you should memorize. So 10 weeks, you have most movements. 11 weeks, you have yawning. 12 weeks, you have sucking and swallowing. 16 weeks, eye movements. And 18 weeks is when the mother starts feeling the movements. The sensations that a fetus feels are touch. First, this is the first to develop, and it develops at 8 weeks. So imagine like, your mother is pregnant and she goes to an ultrasound to get it checked, and the movement is detected at 8 weeks. So when an ultrasound is placed on the mother's belly, the baby feels it. So that's the first time it feels touch. That's just like a way to memorize it. And this touch fully develops at 14 weeks. Hearing develops at 22 to 24 weeks, which comes with habituation. What is habituation? Habituation is like when you get accustomed to or used to a voice, and in this case, it will be the mother or the one giving the birth. So at 22 to 24 weeks, you start hearing noises and you start getting used to your mother's voice. Um, this hearing, once it starts developing, it starts off with lower frequencies, and then it goes into the higher frequencies of the normal range of an adult. Smell and taste, there's no particular timeline where they start to develop smell and taste, but it can be observed. And how is it observed? There are experiments where, you know, uh, people will insert like noxious smelling gas into the amniotic sac, and they'll notice that the fetus moves away from the bad smelling gas. Or if you put something sweet tasting into the amniotic sac, they notice that the baby moves closer towards it. That's how you can tell that there is smell and taste development in the fetus. Pain starts at 26 weeks, and the way we learned this is quite cruel. But what happens is they insert a needle into the amniotic sac and they try to poke the fetus, and they notice that the fetus moves away from the needle once it's been poked. And sensations for vision, there's no vision development at the fetus level. It only happens after you are born. Now, most of our time as humans and as fetuses are either awake or asleep. And there's four states associated with it. When you're a fetus, you're either awake, asleep, which is 1F and 2F, or awake, which is 3F and 4F. 1 second. If this works, does this work? Okay, yeah. Uh, so when you're 1F, you are quiet sleep or quiet asleep. And the main points are that you have no eye movement and a stable heart rate. It occupies 15% of your time at 36 weeks, 32% of your time at 38 weeks, and 38% of your time at term. When your uh, 2F is active asleep or active sleep, and you have frequent eye movements and body movements, and you have occasional acceleration of heart rate. And this is the most common state, and it occupies 42 to 48% of your time as a fetus. When you're awake, you're either 3F or 4F. Quite awake is when you have eye movements, but nothing else. And the way I like to think of it is it's like a sniper who is trying to track down his target. He's only moving his eyes to follow the target, and everything else is stable and nothing is moving. Then you have 4F, which is active awake. You have continuous eye and body movements. You have tachycardia, and this occupies 6 to 7% between 36 and 38 weeks, and it occupies 9% at 40 weeks. So the difference between active asleep and active awake is that you have continuous tachycardia in active awake, whereas you have occasional tachycardia in active sleep. Quiet awake is just eye movements, and quiet sleep, you have no eye movements. Okay, moving on. Um, this is just drugs and their effects on a fetus, on fetal development. I'm gonna go over them quickly, but like I don't think you'll memorize them right now. Just go over them later on. Prescription drugs, thalidomide, you have arm and leg malformations. Warfarin causes mitral regurgitation and microcephaly. Tetracycline causes tooth malformation. Substances of abuse, you have heroin, which causes fetal and newborn addiction. Alcohol causes fetal alcohol syndrome and has the effects of alcohol on a fetus. Smoking causes spontaneous abortion. Rubella causes cataracts and deafness. Herpes causes microcephaly. Varicella causes muscle atrophy and mitral regurgitation. And radiation causes cell death, mental and growth retardation, and chromosome injury. Um, that's pretty much it for the first lecture, which was infant development. I have some questions. I don't know if you guys will answer them, but I hope you will. Just type in the chat or unmute yourself if you know the answers. So the first question, which of the following is true regarding development of senses in a fetus? They can hear at 20 weeks. The neural pain pathways develop by 26 weeks. Touch is the last sense to be developed, and they are unable to differentiate between noxious and sweet taste. Someone said B, and that is correct. Congratulations. Second question, when can yawning be observed in a fetus? 11 weeks, 10 weeks, 12 weeks, or 16 weeks? That is true. A couple of people said A. Thank you for responding. That is correct. And the last question, normal motor milestone is developed as follows. Oh, that's for the next lecture. I'm sorry, that's a wrong question. My bad. Uh, but moving on to the next lecture, which should have, yes, infant social development. Um, so this is the normal development. You've given birth, you have a child now. These are the normal birth development or milestones that a child goes through when they are born. At 1 to 2 months, they lift their head from their stomach position. And this is very important to note because if you lay your baby down before 2 months on their stomach, then they have a very high chance of developing sudden infant death syndrome, also called SIDS, where they cannot lift their head and they can't breathe because they're being suffocated because they're held against their mouth and nose is against the floor, so they just die. So it's very important to note that. At 3 months, they control their head in sitting position. 3 to 4 months, they roll over and reach for objects, and they also have smooth pursuit. So I'll be covering later on, but like at around 3 months, visual acuity is established. So um, because they have proper vision now, they are able to follow and track moving objects, and that's what smooth pursuit is called. And the attainment of the skill is known as eye-head control. And this is a very common question that's asked. They'll say when a baby is able to track a moving object, or smooth pursuit is called what? Eye-head control. Don't forget. You also have at 5 months no head lag, and this is important for Down syndrome because uh, kids who are normal kids will have no head lag by 5 months. And head lag is when you're lifting a baby. Sometimes you notice how their head like flops back when you're moving them around. By 5 months, this should not be there. However, patients with Down syndrome will have head lag when you are carrying them around. At 6 months, they transfer objects from hand to hand. At 6 to 8 months, they sit independently. 8 to 9 months, they can crawl. 9 to 10 months, pull up to stand. 10 to 11 months, pincer grasp. And 12 to 15 months, they learn to walk. There's leeway for this, so it's normal. It's fine to see like a 16 or 17-month-old who hasn't walked yet, but anything past that is abnormal and should be checked. Now, when we are born, uh, everything is a clean slate. So everything around us is new information, so much so that the faces that we see are new to us. And the process of learning faces is very crucial to social development. So we'll be talking about social development in relation to faces and vision. So like I said, it revolves around visual acuity. It starts at 2 to 3, which starts at 2 to 3 months. And before that, because you've not properly established visual acuity, you have no preference. And after you've established visual acuity, you do have preference to see of faces. And this is very top heavy. Before 2 to 3 months, it's very top heavy. So any place with high contrast, such as the border between your forehead and the hair, is more preferred for a child who has not established proper visual acuity. And these top heavy features are called external features. So the line, like I said, between your forehead and your hair, or your beard and your face, etc. Which is why kids tend to scan for external features at 1 month before they have properly gained vision. And then they scan for internal features at 2 months when they're starting to have proper visual acuity. And these internal features are, stuff that makes someone recognizable, such as their mouth, eyes, nose, etc. At 3 months, when they have established proper vision, they can tell apart their mom from other females, and they tend to look for their mother for pleasure. And they can recognize, once they have properly gained visual acuity, they can recognize someone by just looking at their external features by 4 months. And by 6 months, um, by being in their surroundings, uh, being in a household where you can see your mother, your father, and your siblings and whatever, you gain a prototype of what a face should look like. And that prototype becomes something that you judge against for attractiveness. So if someone you see is a stranger and does not look similar to your father or your mother, then you start thinking of them as less attractive and you start looking at them less, which is why, for example, someone who was brought up in where I'm from, India, where predominantly we are brown skin tone, right? If I was, as a baby, were to see someone who was white, I would feel as though they are less attractive and I would look at them less, if that makes sense. Another thing to note is that once they gain visual acuity, children tend to look at people's eyes. They tend to gaze, and it's especially around your eyes, which is an internal feature. And if they do not do that, it could be indicative of a vision problem, which should be checked. Anyways, more about the eyes. Okay. At 4 to 5 months, infants are able to recognize moving objects of themselves over others. At 8 months, they can look at images. They could look longer at images of others. At 12 months, they can recognize faces from different angles. And like I said, they tend to look at more attractive faces, which is based on their prototype. And at 18 to 24 months, they can recognize themselves in a mirror. And all of this happens through a process called lateralization, which uses the right hemisphere of someone's brain. So for facial recognition, you use a process called lateralization, which uses the right hemisphere. In general, although this is not law or rule, infants tend to find female faces more attractive than male faces because they are usually brought up by their mothers or caretakers who are female. So they tend to look at female faces more than male faces. And another thing to note is all of these are milestones that happen in normal children or normal developing children. Children who are autistic tend to not reach these milestones, so it's something to look out for. Another thing to note is that eye contact is very crucial when playing with a child. So as an adult, eye contact is very crucial because if you don't engage in eye contact, and like I said, kids tend to look at your eyes. If they see that your eyes are wandering off, then they might feel a little uneasy and feel like, oh, I'm not important, so I should isolate myself because my father or mother is not looking at me while I'm playing. One way to prove this is One way that this was proven is using the still face experiment, uh, which was where you have a child and a mother playing with each other, and they're having fun, whatever. And suddenly the mother changes to a still expression where she becomes expressionless and does not look at the child. Um, Followed by normal play, followed by the mother resuming her normal expressions and having fun with the child. It was noted that when the mother did a still face, the child seemed to have less interest and seemed to get uneasy when that happened. So it's very important to maintain eye contact while play. Now to talk about feelings. Uh, 1 to 2 days old, they imitate facial expressions, and this is obviously just a reflex. It's not actually something that they do after that because they have not properly attained visual acuity. And at 4 to 7 months, they can attach facial features to specific emotions. So they can tell, especially by around 6 months, they can tell that um, these specific facial features are associated with happiness, and these ones are associated with someone who's mad or angry. And under 8 months, they need the face to identify the expression. So they need to look at someone's face to identify the emotion that the face is displaying. Over 8 months, they can identify emotions through voice recordings. So if they hear a voice recording of someone shouting, once they are over 8 months, they can understand that, oh, this person is mad. In terms of the emotions that the child or the infant itself feels, there are three different types of emotions. There's primary emotions, self-conscious emotions, self-consciousness, and self-conscious emotions. Primary emotions are the first ones that develop, and most of them develop within the first 8 months of life. And usually, the first, or hopefully the first emotion that you feel is joy, because children tend to be in more loving households. If you are not in a more loving household, joy might not be the first emotion that you feel, but generally it is joy at 3 months. Then followed by anger at 4 to 6 months, like when you are not being fed at the appropriate time, or your toys are not there, or your mother's not around, so you start feeling angry. And you have fear at 6 to 8 months. You also have disgust, surprise, and sadness. Sorry. Then you have self-consciousness, which is not really an emotion, but it is the birthplace of an emotion, which is empathy. And it's a acknowledgement. It is associated with self-acknowledgement. Self-acknowledgement being the ability to experience other emotional states. So it's not just these primary emotions, but the ability to experience other emotions, which are these self-conscious emotions. And self-conscious emotions develop around the third year of life. And these emotions are empathy, jealousy, and embarrassment. And then you have self-evaluative, self-conscious emotions, which are shame, guilt, and pride, which are self-explanatory, hopefully. Now you have attachment. Okay, so there were four pioneers that talked about attachment. I think it was four, hopefully. Okay, four people who talked about attachment to infants and infants to their caretakers. And we will be talking about most of them right now. The first one being John Bowlby. Bowlby. He arranged attachment into four different phases. The first phase being pre-attachment, which is 3 months. It's where you start getting oriented to your mother. You follow her around, getting used to her face, starting to recognize her. You know, the pre-attachment. Then you have phase two, which is attachment in the making, 3 to 6 months. It's where you start seeing your surroundings and start becoming attached to more than one person. So attachment in the making, you can become attached to multiple people or a singular person if there's not many in the household. Then you have clear-cut attachment, which is 6 to 24 months, so up to 2 years of your life, most of the time. It's when you are completely attached to a singular person and you start crying when you're separated from them. Then you have the fourth phase. There is no name for it, and it's over 25 months. And it's when you can be left alone and the mother or the caretaker can, you know, leave to go shopping without having to carry you around. Another person who talked about attachment was Mary Ainsworth. And she said that during your first year, you can be, or you can express four different types of attachment. You can express ambivalent, which is just confusion. Secure attachment, which is predictability, where a child is more predictable. You can tell when or what emotions they will display based on what happens to the person that they are attached to. Avoidant, where they don't care much about what happens, and disorganized, which is a combination of all three. uh, then you have D.W. Winnicott, and this is very important. Uh, okay. For good mothers, the home is like a good, the home is supposed to be a good holding environment where the kid feels safe and um it creates a safe environment which allows the child to express its true self. The true self being just the true emotions that a child feels and the true thinking that a child goes through. And a good mother, good enough mother, is one that allows a true self to emerge. As a therapist as well, you're supposed to create a good surrounding to allow a safe space in which a person who comes to you can express their true emotions and allow their true self to be on display. for effective, therapy sessions. And the way to do this is through, like I said, a good holding environment or a safe space, as well as using transitional objects. Now, in the case of a mother and her child, a transitional object is just something from that good holding environment. So, let's say, you know, mm, uh, a spoon, a spoon from your house that you take around with you, you carry around, and whenever you feel unsafe, you can take out the spoon and say, "This is from my good holding environment, and it makes me feel safe." A way a therapist can do this is obviously your clinic is your safe space. So you take something from your clinic, for example, a business card, and give it to the person and say, and this acts as a transitional object where when the person is outside and he feels unsafe, he can hold on to the business card or he can call you to using that transitional object to feel safe, if that makes sense. I hope that made sense. Okay. Now, social development too mainly revolves around play and how play is used for developing a child's in terms of social function, cognition, and culture, and how they use play to learn to communicate. I think before we go into this, I think it's better if we take a break for Salah for Asr right now, if that's okay with you guys. Can you hear me as well? I don't know if you guys can hear me. I hope you can hear me. Uh, so we're gonna be talking about play right now, which is very important for social development. It's also very important for cognitive development, and in order to ingrain a child with the culture of the area that they're in. And it's also a way that they learn to communicate with others. Um, so the first thing I want to talk about play is what types of play there are. Generally, in the first year of a child's life, it is called exploratory play, where, like I said, everything is new around you. So you're trying to process the information through play, which you find more enjoyable, and you're exploring the world using it. After the first year, play becomes from exploratory to more symbolic, and symbolic play is just like pretend play with, toy cars or toy airplanes. So keep that in mind. First year is exploratory, and second year is pretend play or symbolic. Both of them, exploratory and symbolic, are divided into a few parts. Exploratory play can be, let me bring out my pointer. It can be it can be unitary functional, which is just like conducting a function specific to an object. So you throw a ball or squeeze a squishy toy. That's unitary functional activity. Then you have inappropriate combinatorial, which is just the mixing of two objects or toys which don't usually go together. So you're putting a ball in a vehicle, for example. Then there's appropriate combinatorial, which is when you're putting two stuff together, two objects together that do go together. So putting what are they called? Action figure into a toy car that fits. That's appropriate combinatorial. Then you have transitional play, and transitional play is just like you could say it's a precursor to symbolic play, where you show stuff that could be indicated as symbolic play, but there's no confirmation. So, for example, you're putting the telephone close to your ear, but you're not saying anything to the telephone. Uh, Now you might see on the table that there is like these 13 months and 20 months. These numbers and values are very important to memorize. I'm not going to go over them, but you should go over them, and she does question you about them. Then we have symbolic play, which is also divided into four parts. You have self-directed play or self-directed pretense, which is when the play is directed towards yourself. So, like eating from a spoon or drinking from a cup. Then you have other directed play or pretense, which is just play that's directed towards another person. So you're playing with a toy car and you start making car noises, car goes vroom. That is other directed pretense, and that's pretend play. Then you have sequential pretense, which is just two events consecutively. So, you dial the telephone and then you hold it up to your ear and speak into it. That's sequential. And then you have substitution pretense. So you pretend that an object is something that it isn't. So you pretend a block is a telephone, or your hands or fingers are people. That's substitution pretense. Again, these values are also important, and it's the same ages, 13 months, and this is 20 months. Uh, Playing is really important. It serves many functions. One of the most important being that it's therapeutic, and it's very useful for the development of a child, and it's divided into categories called domains, which aid in developing, reasoning, creativity, problem solving, memorization, concentration, and help with interacting with the others. So the first domain that we want to talk about is the intrapsychological domain. Uh, like I said earlier, it's very important as an adult to pay attention when you are playing with an infant, and to not avert eye gaze, which is very bad for development. It's also important as an adult to initiate play, and to stop play. I have no reason why, but that's what they say. It's important to know when to initiate and how to stop play. Uh, Also important to maintain eye gaze. Like I said, eye gaze stimulates arousal. And it should be noted that it is important to play with them, period, whether you maintain eye gaze or not, because the feeling of joy that they feel when they play with their mother or their caretaker is much more than this feeling of joy that they can feel, or the level of arousal that they can reach when they are playing alone. Um, and generally, when you're taking care of a child and you're playing with them, you try to avoid having many emotions other than joy and happiness, which is why it's also important for kids to play with others at their age or even older, because it allows them to experience and express a wider range of emotions. Uh, which is why the children tend to or prefer playing with other infants between the ages of 17 months to 3 years, as it allows them, like I said, to express a wider range of emotions. The other domain that I want to talk about is the mastery domain. It helps with these three things: self-efficacy, structured and unstructured mastery. Self-efficacy means learning to do things with your own body, such as, climbing stairs, building blocks, etc. Structured play allows for the ability and persistence which solving puzzle needs. So structured play is like, you have a block and you have to place it in the right hole. Um, Typically, when a child is playing by themselves, they will quit early on. Whereas when you have an adult supervising or playing with the child, you are able to motivate them into persevering and figuring out that the square block goes in the square hole. So it achieves mastery. And then you have unstructured play, which has no goal in mind, so it's better suited with peers or like other infants because, adults would get bored and avert eye gaze, like I said, which is not good. Um, and infants will have a longer attention span with each other. So it's important that structured is associated with adults to motivate children and unstructured with peers. Another domain is the cognitive domain, which helps with the acquisition of skills, language, and creativity. And mothers can teach this. How do they teach this? They can teach their children about the correct use of an object or correct behavior when playing, and even the correct language, such as avoiding baby talking back to an infant, as it promotes, you know, proper language use to the infant. And this is especially important between the months of 13 and 21. And playing, especially with peers, allows for a good environment to foster creativity and as well as uh, allow symbolic play to thrive, creating, like a good place for your cognitive domain to grow. Then you have social development or social domain, sorry. And it revolves mainly around reciprocity. What is reciprocity? Um, communicative reciprocation is just like being able to have a proper flowing conversation where, I speak a phrase and then the other person speaks a phrase. There's like a back and forth, just how a normal conversation should go. And that's reciprocity. And it starts developing by the end of the first year and it is fully developed by the second year. And I've seen some questions about this. So they'll try to confuse you and say, when is reciprocity developed? It is developed properly by the end of the second year. Just keep that in mind. And then you have social understanding, which is also developed in the social domain. Social understanding is like being able to comprehend others and your own mental state and respond or express appropriately. Then you have the cultural domain, which differs from region to region or household to household, where caretakers tend to like instill the caretaker's own culture into an infant, such as like in our culture, uh, promoting or encouraging children to even pretend pray or fast as much as they can. It instills their culture, which is cultural domain. That's it, I think, for domains. Now we're going to be talking about how children use play to learn to communicate. So when we speak, no matter the language, it's quite easy to identify the emotions behind someone's talk. So especially when these emotions are heightened, whether it's joy, anger, or sadness, you can quite easily tell, regardless of the language that they're speaking, the emotions that they're trying to express. These are called contours of voices or phonemic contrasts or inflections, all the same thing. Uh, and it's just like a signature that even as a fetus you can recognize. How everyone, just sounds differently. And when as a fetus and you develop your hearing at 22 to 24 weeks, like we said, and you learn habituation where you get used to your mother's voice, um, you're not really hearing any other person's voice. So the fetus becomes the most accustomed to its own mother's voice, which is why as soon as you are born, as an infant, you immediately have a preference to your own mother's voice. Um, then you can, sorry, then you can learn to communicate by looking or making sense of faces. So can distinguish between happy and sad faces at 8 months. And once you gain visual acuity, you learn to look at your mother for pleasure. And you can also, or you do also, look at your mother for seeking information. What does that mean? Um, it's when a child looks to their mother to notice their face or emotions in particular scenarios. So let's say, like, I don't know, Your mother is afraid of PlayStation controllers and starts screaming when there's a PlayStation controller around. The infant will more often than not develop like, a sense of anxiousness or fright, or scaredness when there is a controller nearby. And that's how, or that is learned through their mothers. Whereas if the mother did not scream when there was a PlayStation controller around, the child would not be screaming when there or feel anxious when there's a PlayStation controller around. You get what I mean. Then you have following gaze. So at 8 months, generally, uh, the child will look at something that is novel to them or new to them, and the adults will tend to follow the infant's gaze. Whereas at 12 months, it goes the other way around, where an adult will look at something and then the infant will look at where the adult is looking at to see what's new and what's surprising to them. At 12 months, also, um, sometimes, a caretaker will point at something and say, look at that, look at that. At 12 months, a baby is not able to understand what that means. So instead of looking at where the caretaker is pointing at, the baby will just look at the finger that is being pointed. Whereas at 14 months, for the most part, they'll be able to say, oh, my father's trying to point at, the PlayStation controller. So I should look at the PlayStation controller and not my dad's finger. And at 2 years, this is properly developed and they're able to interpret the point. Moving on, we have language development. So language development is divided into 5 stages. The first stage, 0 to 2 months, called reflexive vocalizing. Reflexive vocalizing is just repeating whatever an infant hears. And this is not on understanding, this is just something that's reflexive. Stage two, which is 2 to 3 months, you have cooing. Cooing is just it's like they sound like a penguin. If you ever heard a penguin, cooing is when someone sounds like a penguin. Stage three is 4 to 6 months, and it's where they start experimenting with more noises. Stage four is 6 to 7 months, and it's called canonical babbling. And canonical babbling is when an infant says a consonant followed by a vowel. So like mama, baba, papa, that is canonical babbling. Stage five is 12 months, where they usually speak jargon, but it's more similar to, or it looks or sounds very similar to proper language. And they also learn to speak their first words at 12 months as well. Uh, you've also, by 6 months, you've also probably figured out your parents' names. So you have associated someone's name with how they look. And you understand 50 words by 12 months and 150 words by 16 months. Uh, that's it for social development. Now I will be going over some questions, if you don't mind answering. If not, I'll answer them myself. It's okay. So the first question is, a baby's focus gets better by 3 months of age and has developed smooth pursuit. What is this skill called? Yes, that's correct. It is A, eye head control. I'm sorry, I don't think anyone's here, so I'll be answering them myself. A client felt distraught after his appointment with the therapist. He decided to call his therapist, and the call went to voicemail. He felt relieved afterwards. Which of the following of D.W. Winnicott's theories best describes this? It is a transitional object, correct? C. Regarding communication reciprocity, which of the following is true? It is well established at 2 years. Yes. Then we have, at which stage do babies orient to their mothers? During the attachment stage, clear-cut state attachment, or fourth phase. And this happens usually at Someone answered. Uh, B, no, that's wrong. It is pre-attachment A. It's when they start becoming oriented to their mother, and then attachment occurs. At which age can a child distinguish a moving image of itself from others? Does anyone want to answer? It is C, 5 months. Looking at emotional development in children, there's no difference between how boys and girls decide about internal and external attributes. Self-consciousness emotions include sadness, anger, and joy. Self-conscious emotions emerge in the middle of the second year of life. Anger emerges between 4 and 6 months, and fearfulness emerges by age 10 months. It is D. Anger usually emerges between 4 and 6 months. Okay, moving on. Oh, there's more questions. I think I'll leave them since no one's answering. Um, but all of these answers are E if you want to look back and answer them yourself. Moving on, we have infant cognitive development. There were also four pioneering approaches which talked about infant cognitive development and how an infant develops cognition. These were Jean Piaget, the nativist approach, information processing approach, and the psychometric approach. And we will be starting with John Piaget, which we will be going into the most detail about, and it's the most important for your exam, I feel like. He talks about cognition through the attainment of something called objectification. Objectification is being able to identify yourself and others as an object that exists in space through time and experiences causality, which is just cause and effect. These are very important keywords to memorize. Object, space, time, causality, objectification, all Jean Piaget. And this happens during the second year of your life and is brought about through schemes. What are schemes? Schemes are just like uh, actions or patterns of actions. Um, and they're divided, this cognition development is divided into a couple of stages. The first stage being the sensorimotor period, which happens between 0 to 2 years. The stages are modification of reflexes, which is 0 to 1 months. Um, it's just like it's just a reflex to something. So, for example, you bring your hand up close to an infant who is 0 to 1 months, and they grasp your hand or your finger. Or when you bring a breast to the mouth of an infant, they start suckling. The second stage is the primary circular reaction, which is 1 to 4 months, and it revolves around the repetition of a scheme that is directed towards themselves. So putting their hands in their mouth. Um, I don't know, I can't think of anything else, but you get what I mean, where it's repetition of an action that is directed towards themselves. Then you have secondary circular reactions, which are just primary circular reactions, but it's directed outwards. So like they find something that they find interesting. So like shaking a rattle and it makes a noise. They find that interesting and they repeat it all the time. That's a secondary circular reaction. The fourth stage is coordination of secondary schemes, and this happens between 8 to 12 months. And it's when you do these secondary schemes in order to create an outcome. This means it's just more intentional. So you're creating the schemes not just because you find them interesting or they're novel, but it's because you are trying to bring about an outcome. Um, it's like, for example, an action, a stage four action would be when an adult brings their hand close to an infant to, you know, squeeze their cheeks, and the baby moves the hand of the adult away. That is a coordination of a secondary scheme. Then you have the fifth stage, which is tertiary circular, which is between 12 and 18 months. And this is when you show signs of being explorative. So at this stage, you are developing more cognition and you're also exploring the world and trying to understand it. So you're using your abilities to perform these second schemes in order to see what happens. So you drop a ball, for example, to see what happens to it, um, if you understand what I'm saying. So you're using secondary schemes to explore the world around you. The difference between secondary and tertiary is that tertiary is explorative in nature, whereas in secondary circular, the baby knows, I know that shaking the rattle will make a sound, and I like the sound, so that's why I do it. Whereas when you're dropping a ball from like a very high height, I don't know what'll happen, but I want to do it because I want to know what will happen. And then the sixth stage is between 18 to 24 months, and it's the beginning of mental representations. Moving on, there's an importance of, whoops, sorry. It's back. Okay. Uh, Moving on, there is a transition from stage 4 to 6 when it comes to hiding objects, which is proof of development of cognition. So when a baby is in stage 4 and you hide an object and you show that you've hidden an object, the baby will look at the original location that you hid it in. So if you move the object from the original location that you hid it in to another location, the baby will still look under the same location the first time you hit it. So let's say I showed the baby that I hid a toy under a pillow, and it takes out the pillow and sees the toy. Now I hide the toy under a couch. The baby will still go look at the pillow if he is in stage 4. However, if he is in stage 5 and he is seeing that you hid the toy under the couch, he will start looking under the couch. If you hide it again, he will not be able to find it. If you hide it behind the TV, he'll not be able to find it. But if the baby is in stage 6, he will start to understand that the object can be hidden in multiple locations, so he will start looking for it at multiple locations, if that makes sense. That's the experiment called A not B. Just remember that. It is for development of object permanence. That's it. Then you have the stage of pre-operational thought. This happens between 2 to 7 years. And during this stage, children cannot think logically, which is why you cannot punish a child at this age by telling them, go and think about what you've done. It just doesn't work because they have no concept of logic and how, like, for example, breaking a piece of glass is bad. They also can't grasp sameness. So if they see like a nursery teacher outside of school, they start freaking out because you're not supposed to be here. You're only supposed to be at school. Uh, they think that they also think that punishments for their wrongdoings is inevitable, and they have what you call imaginative thinking or magical thinking, where you'll hear a complaint from your teacher that Oh, your child started jumping off the stairs because he thought he could fly. That's called magical thinking. They are also egocentric and believe they are the center of the universe. That is the stage of pre-operational thought. Um, these points that I've listed on the slide are very important. They are quite often tested about, so keep that in mind. Then you have the stage called the concrete operation stage. And this happens between 7 and 11 years. They stop becoming egocentric and they start thinking more logically. They are able to understand the concept of conversation. So, like I said, the back and forth. They can start making their own deductions and conclusions and have their own thought processes. And they can finally also understand the concept of quantity. Like how a baby or a child will go, they'll tell you, yeah, I have 4 bajillion toys at home. And a lot of the times they actually truly believe that they do, but that's not the case. And it's around this age, 7 to 11, where they start understanding quantity and say, no, no, I don't actually have 4 bajillion toys at home. Then you have the stage of formal operations, where you will have more abstract forms of thinking. Um, and kids or adolescents in this age are able to deduce and have a more like formal line of thinking. So, for example, my friend hit me with the ball and I got hurt and I was sent to the nurse and then I got patched up. And because I'm hurt, I was sent back home. And because someone hurt me, that kid was punished and was also sent back home. And that's more like, more logical or formal line of thinking. They can also think of probability or grasp the idea of probability, and they use more complex language. And one thing to note is that although you should know the numbers or ages mentioned here, the previous numbers, they're not like concrete, which is why you might have someone, in their 20s presenting with like the thought process of a baby. Now that's an extreme example, but like, yeah, it's not a rule that they develop these in order, or sorry, uh, in the same timeline as I mentioned previously. But for your exam, you should know those numbers. Now we've moved on from John Piaget, and we're going to be talking about the nativist approach. It's a little bit confusing, so bear with me. So let us say we have a block or cube, and behind the block is a rod. When you are the nativist approach is talking about how a child will look at these physical objects and extrapolate information based on its properties. And the way that you think or process this information about the object, it changes as you age. Uh, and it is proof, therefore, it is proof of cognition. So let us say we showed this block with 2 rods to a newborn. It'll look at it, be interested in it, whatever. And then we remove those objects and we replace it with just a singular rod. The child or the newborn will look at the singular rod because they have never seen the singular rod before, whereas they got used to looking at the rod behind the block. However, the same does not apply to a 4-month-old who will look at the block with the rod behind it. And once you introduce a rod, a singular rod, it will not look at the rod, but it will keep looking at the block with the rod behind it because it's new. That's how you interpret the nativist approach. And then you have the information processing approach, which doesn't have much to explain, but it just says that like, there's a set of cognitive and sensory processes They're constant across development, regardless of what type of upbringing you have. And the knowledge these kids develop later on in life is based on these primitive primary functions that you learned as a child. Then you have the psychometric approach, and it just says that kids cannot be compared to adults, and as such, there should be a standardization when approaching the cognitive development or testing the cognitive development. So they made the Bayley scale, and it can be tested. It is used on 1 to 42-month-olds, and it tests five areas of cognition and development. It tests cognition, language, motor function, social and emotional development, and adaptive behavior. Now, although this can be used to check the development of cognition in 1 to 42-month-olds, it cannot be used to predict IQ of someone later on in life, as that can change. The psychometric approach also talks about habituation, which can be used to confirm, that like there has been development or cognitive development in a child because if someone becomes habituated to a stimulus, that means that they know that this has been seen before and I've seen this before, so I don't need to be looking at this anymore. I'll look at something new, like we did with the nativist approach over back there. Moving on, uh, you have innate social knowledge, and this was like a thing between Piaget and these two scientists called Meltzoff and Moore. Piaget says you begin imitations at 8 to 10 months, and you start to imitate new things at 9 months, and this has been tested on before quite often. And 18 to 24, you defer imitations. And what does defer imitations mean? It means that, um, let's say you see on the TV someone throwing a football. You see someone throwing a football, or sorry, kicking a football. Uh, and then 2 hours later, you start kicking your ball in your play area. That's called deferred imitation, where you are delaying the imitation that you're producing or conducting. Meltzoff and Moore, they also said the same thing. They just add on to it that imitation is just an early developing system, and these imitations are a starting point of development and not the end point of development. And generalized imitation, just as a recap, generalized imitation starts between 9 months and ends at 20. That's also been asked about before. So generalized imitations at 9 months to 20 months, imitate new things at 9 months, and you defer imitations between 18 to 24 months. Then you have the sequential touching procedure. Um, Sequential touching procedure is when you introduce like two almost similar stimuli, but one is newer than the other. So you have a ball and a square, and they're both the same size, the same color, everything about them is the same except the shape. The baby, once you introduce these two things to the baby will go after the one that he hasn't seen as much or the one that he hasn't seen before at all, which is the novel stimulus. And that's one way that babies categorize stimuli is by novelty. So they will look at a stimulus and say, "Oh, I've seen this before," and that's how they categorize information. They can also categorize information based on perceptual or dynamic, where perceptual is just how it looks and dynamic is how it behaves. You can also Babies also categorize information based on perceptual schemas and image schemas. Now, this is kind of confusing, but perceptual schemas are how an action looks, and image schema is how it functions. So image, although it's generally, image is just like a picture. In this case, image is function, and perceptual is image, or how it looks. You also have a bunch of different categorizations, like, babies can categorize information based on color, shape, size, but these are the important ones that, you will be tested on. And this sequential touching procedure that I just talked about, it is used to show proof of categorization of information based on novelty and familiarization. Then we have language development part two, which is the second lecture. Just before we start, I just wanted to have or go through some vocab, and these are also tested on, very commonly tested on. Almost guarantee the question in your exam will be about this. Phonology is just how the sounds of language or how words sound. Semantics is what words mean, so the meaning behind words. Grammar is how they're arranged to make sense. Pragmatics is how verbal and nonverbal cues are used to communicate with others. So, between 0 to 12 months, uh, during the beginning, which is 0 to 6 months, infants tend to cry for almost anything. They cry for any sort of discomfort or to communicate any sort of negative feelings. Um, and by 6 months, they can recognize phrases, they can tell sound patterns, like the meanings, like they understand the meaning of apple or mommy and daddy, and they can tell the difference between P and B, just like, the tone of a language or the inflections like we talked about earlier. Um, and even as early as 6 months, they can recognize the tone of someone's voice and the associated emotion with that tone. So if someone raises their voice, they can understand that this probably means that they are angry. And they also look at the mouth movements associated when making a word or saying a word. They won't understand what they're hearing, but they'll able to tell the sounds that you are saying. And by 10 to 12 months, or sorry, 6 to 12 months, they go through, like we said, canonical or reduplicated babbling. And they can discriminate most speech sounds regardless of language, and this happens at 6 to 8 months. And then you have 10 to 12 months, which is the beginning of comprehension, where they start focusing on words that they understand. And then you have variegated babbling, which occurs at 11 months. And there's a key difference between variegated babbling and canonical or duplicated babbling, where, like I said, canonical babbling is consonant followed by vowel, so baba and mama. The importance is when it's canonical babbling, it has to be repeating phrases. So ba and ba. So ba, ma and ma, mama. That's canonical. But when it's two different phrases, so ba do or gu ga, that is variegated babbling because it's not two repeating phrases. That's very important to note. The reason I didn't mention this earlier is just because it's not an actual stage of speaking, whereas canonical babbling is a stage of speaking, and I didn't want to confuse you guys. This is not a stage. This is just a type of speaking or babbling. And it's important to know the difference between them. Uh, Also to note is that the way infants learn languages is by picking up on the speech patterns and regularities in speech. They encode sounds and pay attention to their frequency and sequence. As a result, infants tend to categorize speech sounds based on, common phonemes that they hear or like common phrases that they hear. That's why when talking to infants, in order to not overload them, it's easier to use simpler language and it's better for development. Then you have 12 to 8 months. This is uh, the stage of rapid progression of cognition in terms of language development, where they learn 9 new words a day. They also use words productively and in context, so they start asking questions. They learn new words using old ones in context as well, and they understand social cues, and they can use grammar to understand the type of word that they are trying to learn. Now, before 8 months, um, we mentioned this earlier, but before 18 months, sorry, you are unable to differentiate yourself in the mirror from another person. On top of that, you have poor language development. And that's the reason or the explanation behind childhood amnesia, where, if you ask someone, do you remember when or what you were doing or what happened in your life before you were 2 years old? Most people, if not all people, will not remember. And it's because they don't have a sense of self because they don't know how they looked like in the first place and they didn't speak at all. So, and memory is very strongly associated with visual cues and um, voice cues, vocal cues, which you did not have at the time. Moving on. Oh, okay. You have assessment of memory. I was too lazy to make notes for this, so uh, I made a voice recording. I hope this works right now.
Assalamu alaikum, guys. This is past Basil. I was too lazy to do the slides or like write the notes for the slides, so I'm just going to say it right now. Assessing memory for infancy during infancy is quite difficult because you have not developed language enough to assess memory. But it can be inferred through observational changes. One of them is operant conditioning. So let's say I give a toy every time a kid says goo goo gaga. Now, this child, having retained the memory that saying goo goo gaga gets me a toy, he's going to say it more often throughout time, which is kind of confirmatory of the fact that he has gained memory of the fact that, he gets a gift every time he says goo goo gaga. And this is called recall memory, where you're able to retrieve information in the absence of cues or prompts. This is tested through different imitations. So, you see a child sees his dad on the computer. So 2 hours later, the child starts clacking on his lap, trying to pretend like he's on a computer. That's deferred imitation, and it's proof of memory retention. Another way is recognition memory, which is just memory due from using your eyes, using visual cues. And a way to test this is something called the visual paired comparison task, where you just put two stimuli in front of a child, so a ball and a cube. The child would have seen the ball before, so this time he is more focused on the cube because he's used to having the ball at home, if that makes sense. That's called the visual paired comparison task. You also have a different type of memory called declarative memory. This is memory for specific events in your life. And this is difficult, very difficult to assess. Actually, it cannot be assessed in infants. But you should know that it uses the medial temporal lobe of the brain for retaining declarative memory. Another memory is called procedural memory, and this memory can still exist even if the temporal lobe is injured or damaged. And this memory is for habits and skills. So it's stuff that's more like ingrained in your head and it's not specific to events, it's habits and skills. That's it from me. Thank you.
All right. Thank you, Basil. So back to me. Oh, that's great. We're done with cognitive development. We just have a few questions if anyone would like to answer. So the first question is, Image schemes is a categorization based on image schema. It's based on, someone answered. Yes. B. That's good. Which of the following describes children's ability to recall the past memories and add fantasy to their thinking? Did I do this? Mm, that is, I don't think I've done this. I did not cover this. Let me just go over it quickly. We have two more types of memories. We have something called uh, reconstructive memory, and we have something called reproductive memory. Reconstructive memory is a type of memory that uses magical thinking. So a child will go say, yeah, will tell his mother, yeah, today I was at school and there was a dragon that showed up and me and my friends, we slayed it. We killed it with, our swords. That's reconstructive memory, where they construct their own memory. And then you have reproductive memory is where they just recall the events accurately. So when someone recalls past memories and adds fantasy to their thinking, that is reconstructive. Sorry, which is A. Just some more questions. In which stage of language development does jargon happen? Uh, Incorrect, guys. It is the last stage, which is at 12 months, which is stage 5. Yes, correct. Which one of the following is auditory unit of language? Is the auditory unit of language? Yes, A, correct. And last one, which of the following is true regarding objectification? Now, moving on to our last topic, our last two lectures, which is early and late childhood development. Okay, so we'll start with early childhood development, which begins at 3 to 6 years of age. Someone asked what was the answer for the previous question. It was correct, whatever you guys wrote, which is that it develops through schemes. D. Now, early childhood development. It starts at 3 to 6 years of age, and the end goal is to be able to process biopsychological stimuli. So it goes through a few steps. The first step being reception of a stimulus. This is often a question that's asked in the midterm, where they're like, what's the first step of processing biopsychological stimuli? Reception of the stimulus itself. Kind of a tricky question. Then you have the initial emotional response to that stimulus. Then you have the initial output or behavior towards that stimulus. Then you have, observation and 5 year capacity to self-reflect, where someone tells you, hey, you should think about that again, or think about the action that you've done again. And then you construct a new representation or a new final output to that biopsychological stimuli. And the major developmental tasks in early childhood is the creation of an autonomous valued identity, which is just like, I mean, I know it says I don't know what that means, but it just means someone who has a sense of self and has their own, beliefs and opinions, and the ability, oh, and also the development of a gender identity. And gender identity, very simply, is just identification of whether you're a male or a female. Along with gender identity, you have gender role, and these are tasks specific to a gender. And obviously, this changes based on your culture and different religions in different regions around the world. But it is important as a caretaker to make sure that an infant's gender identity is aligned with their gender role. So, if someone is a boy and in that culture, you don't, boys don't wear earrings or something. It's important to make sure that they don't do that so that they don't have an identity crisis later on in life, or they have a problem with the formation of an identity. Still in the 3 to 6 years of range, you have maturation and development of inner needs. This is called the early genital phase. And around this age, around 3 years of age, they'll start focusing on their genitals. So you'll see oftentimes that the kids at that age will start touching their genitals or investigating their bodies, exploring their bodies. And we know as adults that that's not a good thing. However, they do not know that and they do not understand that. So it's important to reprimand them for this, but like you cannot overdo it, as overdoing it will create more curiosity and lead to them doing it more, which is bad. And obviously, ignoring them and letting them do what they want is also bad and leads to worse consequences. There will be, like occasional exhibitionism, which is where, they take off their pants, and it's important to tread like a fine line in order to stop them from continuing this behavior. Using statements like, if you keep doing that, your arm will fall off, or uh, if you keep touching that, your head will explode. That's not a good way to do or reprimand them for this because it creates a negative response and makes them more anxious about it. Um, then you have maturation and development of physical abilities at this age. You have increase in body weight, size, and you have increased motor coordination. And a growth spurt usually occurs at this age between 3 to 5 years. And then you have maturation and development of cognition abilities, the theory of mind, which starts at around 4 years to 4.5 years of age, where they start, understanding that different people can have different opinions and it can be separate from mine. And at this time as well, they start to have magical thinking and are able to pretend about another reality. The final one is the maturation and development of temperamental characteristics. What does that mean? Temperamental characteristics or temperament is just a way to describe a person's character and traits, including how like they cope with emotions and regulate them, and how they deal with surroundings and scenarios. Someone's temperament can be described especially for infants, can be described into or can be categorized into 9 different parameters, and these parameters were headed by Chess and Thomas, which were scientists. And these 9 categories are, your activity level. Some kids will be more active than others. Rhythmicity, where you have how lax are you or how stringent are you on the patterns of time of when you have to eat and when you have to sleep and how long you have to sleep and how that affects your mood. Approach of withdrawal, adaptability to change. Approach of withdrawal is, when someone is introduced to a new stimulus, if they move closer towards it, then they are more of an approach temperament, and withdrawing away from it or drawing back is more of a withdrawal temperament. Threshold of responsiveness or sensitivity, intensity of reactions, your mood, your degree of distractibility, and your persistence. So according to these parameters, a child can be three things. They can be easy, they can be difficult, or they can be slow to warm up. When a child is easy, very self-explanatory, you know, they have lax rhythmicity, they have a high adaptability to change. Where is that? Adaptability to change, and they have a high threshold for responsiveness and low sensitivity. And they don't have a very bipolar mood. Not whereas someone who is difficult will have, very high mood swings, very high intensities of reactions, very strict rhythmicity, very low adaptability to change. And someone who is slow to warm up is sort of like someone who is easy, but it just takes time for them to adapt to their stimuli or their new surroundings before they become more of an easy temperament, if that makes sense. Moving on. Okay. Continuation of maturation in early childhood. Maturation and development of emotions. By 4 to 5 years of age, kids would have developed to learn or would have learned to regulate their own anxiety. Um, but it is also important as a caretaker to identify or know when a child is anxious and understand why they are anxious and try to solve the problem so that they learn this skill later on in life. And you have also maturation and development of verbal language abilities. By age 3, like we said earlier, they have their own beliefs, and using speech, they can make their own beliefs and predict events using reproductive and reconstructive memory, which we just talked about. I guess it was over here. So, reproductive memory, like I said, is more accurate in retelling of events, and reconstructive is more magical. Moving on, during your early childhood, you also have the development of a superego. Superego is like, your own internal parental figure. So it governs your own moral compass, and you have your own moral compass through your superego, and it tells you what's right or wrong in your own eyes. This means that if something you did was morally wrong, your superego will make you feel guilty and bad about it. And it is important to encourage something like this because it creates a good, ethical standard to which a child should follow. However, you should not overuse this or guilt trip a child, um, as it can cause something called superego anxiety, where they feel as though they have they feel guilty over almost anything negative around them happening to them or to someone else around them. Now, um, you have also adaptational capabilities. You have repression, which occurs at 18 months, which starts occurring at 18 months and is prominent at 3 years of age. So it starts at 18 months, but it is more developed at 3 years of age. And what is repression? It's just an automatic, unconscious process that happens in your brain, that that removes something from your conscious awareness into your unconscious awareness. So something traumatic may have happened to you, and you will repress that memory by, changing it from your conscious mind to your unconscious mind so that it does not hinder you in your day-to-day life. However, although repression is fine, it may be overused, especially if a child has gone through a lot of traumatic experiences. Now we have late childhood, and this is between 6 to 12 years of age. And it is revolved around self-representation. What is self-representation? It is these three things. So your sexual identity, your peer identity, and your conscience. What are these things? They develop sort of at the tail end of your early childhood, and then they become more prominent or fully developed into your late childhood. Uh, Sexual identity is just attraction, sorry, attraction to the other gender or the opposite gender. Peer identity is figuring out where you fit in a group or amongst your peers or friends. So whether you're a leader or a follower, or you're in a communist gang and everyone's equal. Uh, and you have also your conscience, which is your ability to distinguish between right or wrong. Now, if you live or an infant or child lives in a more strict household, uh, parents don't usually give the opportunity for a child to properly express themselves, and it ruins their ability to have, a sense of self. So it's important to be aware of that. Other things that happen during your late childhood is you gain a social identity. And if you remember from Piaget's concrete operations, you are able to start reasoning logically. You understand quantity. You understand other people's perspectives. You develop more complex categories and use more complex language. And you can compare past and present. Continuing, moving onwards, you have adolescence, which is 12 to 19 years of age. It is divided into three age groups. You have early adolescence, which is 11 to 14, middle adolescence, which is 14 to 17, and late adolescence, which is 17 to 20. This is signified or um sorry, no. During early childhood, it is signified mainly by puberty, which is initiated by hypothalamic pituitary adrenal gonadal axis. This is more biological. Whereas in behavioral science, we talk more about the adolescence in a psychological perspective, where you start gaining your personality and you start having more cognitive development. This is the formal operation stage, if you remember from Piaget. You also have negativism. Negativism is sort of like nihilism. I don't know if you've noticed, but usually at this age group, a lot of people they tend to be more nihilistic, or they say, oh, I'm depressed, the world sucks, everyone hates me, I hate everything. That kind of thing usually happens at this adolescence age. Uh, and you notice that peer groups become a more central part of your life. So you see that um, people at this age tend to prioritize their friends over everyone else. You also have a development of more of a more complex moral compass. So you're able to tell, what is right and wrong more correctly than children were able to. And speaking of morality, we have three different types of morality, or three levels. We have pre-conventional morality, which is just when you do something good in order to avoid punishment or disappointment from your caretaker or parent. You have morality of conventional role conformity, which is just like, you're trying to do something to conform to society, or you're trying to please others by doing something. So let's say, you start going around the school and telling your teachers, hey, I picked up a piece of trash today and I put it in the dustbin. That's more of a level two, or role conformity. Then you have the third one, which is morality of self-accepted moral principles. And it's when you have your own sense of morality and your own moral compass. And it's ideally where a caretaker should try and get their children to be at, which is when, they've developed their own sense of justice or morality, and they can tell what's right or wrong on their own, and they can act accordingly. That is it for adolescence. Now moving on to adulthood. It's divided into three again. We have early adulthood, which is 20 to 40. We have middle adulthood, which is 45 to 65. And then you have late adulthood, which is 65 plus. During early adulthood, you are at the peak of physical development. And there are certain developmental tasks that are expected to be accomplished by then, such as, acquiring an education, establishing an occupation, and, forming a marriage or other intimate relationship. You want to achieve at this age financial stability and self-sufficiency, but these goals are not completely accomplished, and there's no specific timeline with which someone achieves them, if at all. During this early adulthood, you'll also face issues such as job changes, difficulty finding these jobs, marriage problems, psychiatric problems. There are a few specific psychiatric problems associated with this age group. And the three I want you to know is depression, psychosis, and schizophrenia. Another thing to note is someone usually at this age, uh, a lot of major relocations happen where someone moves to a new city for a job or a new country for a job, or they move to a new country for university or college. And these people are especially at risk of vulnerability. And it's often attached to you moving to this new place. It's a new environment. You're struggling to find your foothold. You're struggling to find financial stability. It's always stressful. And um, that's why you may come across those psychiatric illnesses that I was mentioning, such as schizophrenia, depression, or psychosis. Not much of this was relevant to your exam. These 3 points are, though. So you're at your peak physical development. You have assumption of physical roles, and you have mostly resolution of the adolescent crises that we mentioned earlier. Around middle adulthood, which is 45 to 65, according to Jung, I don't know who Jung is, but Dr. Nahal mentioned Jung. According to Jung, you're at the noon of your life. And around this age, how well you've taken care of your body comes to question, with physical illnesses being more prominent at this period of your life. Sort of like an accumulation of all your bad decisions earlier in life, eating all your McDonald's and whatever. Another thing that happens is a lot of sexual changes. Um, in females, it's called climacterium, which is just menopause, a fancy term for menopause. And it's usually around your early 40s to early 50s. Your sexuality comes into question because of your body changes and your sexual changes as well. Um, and these issues often prompt individuals to go for cosmetic surgeries or develop body dysmorphias over how they look. Like I said, it's also when women go through climacterium or menopause, and it just adds to the problem of sexuality. And although men don't go through menopause, uh, it's been noted that there is still usually a crisis associated with sexuality around this age. Also, during your age 45 to 65, you have a reflection. You often reflect on, your past accomplishments, and it's important as well um, to set future goals. It's very crucial to set future goals in order to avoid the coming about of a midlife crisis, where, a midlife crisis is where, you feel empty, that you have achieved everything you could have wanted by the time you're 50. Or it could be due to a buildup of, other issues unrelated to your achievements, such as a buildup of relationship issues. You know, you start becoming more impulsive as you age, or depression over, like we said, your physical body or your sexual changes that can lead to a midlife crisis. This guy, Vaillant, I don't know if it's a company or a person, conducted a research and they found that there was a strong correlation between physical well-being and emotional well-being. So exercise and activity can help stopping or averting a midlife crisis. Another thing very important is the empty nest syndrome. The empty nest syndrome is just a common issue that occurs with parents that have children that have left the home. They, their whole lives around revolved around these children. My Your dad works to earn money to support you. Your mother quit her job or stopped working or dedicates most of her life to help you. And once you leave the house, they lose a sense of purpose and direction in life. It may contribute to the development of a midlife crisis. And it's also a reason why there's an increased distance and a relationship between parents. So as parents, it's important to keep strengthening your relationship throughout um your child living in the house or during the raising of your child. Moving on, old adulthood. Okay. This is just like I just listed a bunch of important stuff that you should know. There isn't much to talk about in terms of, psychological development, but just know old adulthood, it's 65 plus. It's divided into two, young old, which is 65 to 75, old, which is 75 plus. Then you have well old and sick old, well old being, healthy and old, sick old being sick and old. And the leading cause of death in this age group is usually heart disease, cancers, strokes. And women tend to see this age more often than men, because men often die earlier, either due to heart disease or, I don't know, accidents. Um, it's important to know the meaning of the biology of aging is senescence, and it's important to maintain social activity as isolation is often a contributing factor to the exacerbation of illnesses that an old person might have. It's also important to note the term ageism, which is just discrimination towards the elderly. It's also important to note that sexual activity during this age is mostly men. I think it's like 70% men and 30 or 80% men to 20% women. And the main psychiatric the main psychiatric problem that is dealt with in this age group is grief. Loss and death is very prominent at this age range, and grief takes over a lot of people during this period, and it's important to have, proper coping mechanisms in order to deal with it correctly and not spiral. But talking about death is our next topic. Just a few vocabulary terms that you need to know. Bereavement is the state of being deprived of someone due to death. Teratology is the study of experiences of dying and bereavement. Grief is the feeling caused by the death of a loved one. And mourning is just the process by which grief is relieved. So there are three different types of death or categories of death. There is intentional death, being suicide or something of the same sort. Unintentional death, an accident or a heart attack or whatever. And then you have sub-intentional death, which is something like substance abuse, where you accidentally overdose, and it leads to death. And you have also near-death experiences. A near-death experience is just like an out-of-body experience where a person was close to death and felt like, I saw lights and it was so peaceful and calm, and I heard a distant noise calling to me. Um, but then I came back to life. And near-death experiences, they have the ability to, and often do, change the way a person goes through their life completely. That's what we just had to talk about death. Now moving on to grieving. There are two main people who talked about grieving into stages. We have Kubler-Ross and Bowlby. Kubler-Ross uh, divided it into 5 stages, and this is not just for grieving of someone who is dead, but it's also used to categorize the stages that someone goes through when he hears about someone who is going to die impendingly. So, you know, your mother, or sorry, someone is having a terminal cancer and they're about to die, and you're very close to them. Although they have not died yet, you still go through these 5 stages. You have, like we said, the 5 stages start with shock and denial. Then you have anger, anger towards, the doctors who diagnosed them, or God, or the world. Then you have bargaining, and it's usually people who are religious or not religious who do believe in God. They start asking, you know, please extend their life, and I'll start doing this. I'll start praying more. I'll start giving more charity. I'll start doing this, and that's bargaining. Then you have depression over the fact that over the news or over their death. And then you have acceptance where, you know, you move on to normalcy. Balbi, uh, he talks about grief into 4 stages. And if you are normally experiencing grief, then you should be normally experiencing these 4 stages. The first stage is acute, despair and denial, and that lasts a few days. Then you have intense longing, physical restlessness because you miss them and you are unable to feel comfortable without them. Um, and that lasts a few months. Then you have despair, insomnia, and weight loss. Then you have reorganization, which is internalization of the deceased. And what does internalization of the deceased mean? It just means that you carry them with you in your heart and soul. So, like, you're like, it's okay that they passed away. They are with me in my heart. Final stretch, we have normal and abnormal grief. In normal grief, you'll have generally initial shock, which is usually short-lived and followed by the expression of suffering, like we said, where they have restlessness, lack of sleep, loss of appetite, or they start dreaming of them. There's another thing for normal guilt, which is survivor's guilt. And survivor's guilt is just, for example, you're two people and you get into a car accident and the person driving with you dies, but you don't die. And you start feeling, guilty of having made it out alive and feels as though, you shouldn't be alive. You should be dead with the other person that died in the car crash. You also have denial, hallucinations, and taking after the deceased. Taking after the deceased is called identification phenomena. It's just like, for example, where someone's father passed away and the daughter of the father starts sitting where the father used to sit during the dinner table, on the dinner table, or they start wearing the same pajamas as their father, or wearing the same ring as them. And this normal grief is in 2 phases. There is acute grief, which is 1 to 2 months, which is very debilitating, and you cannot do normal functions, and it usually passes away after 2 months. You can resume your daily functions, but you obviously are still dealing with grief. And this traditional grief lasts for 6 to 12 months, anywhere between 6 to 12 months. In terms of abnormal grief, you'll have absent grief or delayed grief. You'll have suicidal ideation. So this is not normal. Suicidal ideation is not normal. And the people at risk of abnormal grief are the ones who face sudden loss or horrific circumstances, such as in a car accident or a terrorist action. You'll have people who are socially isolated or people who believe that they are responsible for the death of the person, people who have a history of a lot of traumatic losses, and people who are dependent on the one that they lost. Moving on, the attitude towards death for people depending on age. Um, it's not really age, but more like, cognitive maturity and previous experiences related to death. So at age 5, when you're in the pre-operational stage of Piaget, you think death is like sleep. And I've seen this question before. When you are between the ages of 5 and 10, you have during the concrete operations, uh, you are scared of inevitable mortality. It's just like, understanding the meaning of death. You're beginning to understand the meaning of death. And because of it, you're afraid, usually unreasonably, of your parents dying. During age 9 to 10, you start understanding that death can happen to anyone and you begin to conceptualize it. By puberty, during your formal operations, you start to have a proper grasp of what death means and that it is irreversible, and universal, irreversible and universal. Childhood grief does not follow the same 5 steps that we talked about from Kubler, Ross, and Bowlby. Bowlby describes it into 3 phases. The first phase being the protest phase, where they tend to be more irritable, less expressive and more jittery, and they get annoyed more quickly. Then you have the despair phase, where they become, more isolated, withdrawn, and talk less or interact less. Then you have the final stage, which is the detachment stage, where they become disconnected from the world and they become numb, sort of, don't respond to much. And this stage is often when, if you are a caretaker dealing with a child who is grieving, you would often place them you would place them back into school during this stage so that they can regain normal social functions and cognitive function. Uh, Final slide, just some extras about death and grief. Grief that occurs with the occurrence of loss or anticipated loss is called anticipatory grief, and anticipatory grief is different. It may increase as the date is coming closer. So someone with terminal cancer who says he has like 2 weeks left to die. Anticipatory grief may increase as the days go by, or they may decrease as the days go by, and the death becomes more imminent or inevitable. Uh, then you have grief versus depression. The difference between grief and depression and how to tell the difference, because they often overlap when someone is grieving. Depression is supposed to be a persistent low mood. There's shame and guilt in depression. There's obviously suicidal ideation and threats during depression, and if it is grieving, it is abnormal grief. And there's a time limit on grief. Like we said, the normal time limit being from 6 to 12 months. And if they exceed that time and they're still having a low mood, it's important to check on them to make sure that they are not experiencing depression. And that's it from my end. I think that's the end of the session. I just have some more questions to go through, if you guys don't mind answering. The first question is, which of the following is not part of normal adolescence? Yes, anxiety. B. The next question, which of the following is true regarding biopsychosocial stimuli? Um, A. Yes, receiving stimuli is the first step. The parents of a 2-year-old describe their toddler's nap as being variable, unpredictable. Toilet training is difficult, according to Chess and Thomas. the toddler has difficulty with, it's probably going to be rhythmicity. Next last three questions. Yes. Excluding from awareness, what was once experienced at a conscious level? Which of the following is this? Repression, yes, correct. Which of the following means when children comply with rules on the basis of ethical principles? Pre-conventional morality, morality of conventional role conformity, and morality of self-accepted moral principles. Moral principles. Which of the following is not one of the stages of dealing with impending death? Acceptance, bargaining, anger, suicidal behavior, shock, and denial. That's correct. D, suicidal behavior. That's it. Thank you guys for tuning in. If you have any feedback, just scan the QR code and fill in the form. And inshallah, the next session will be better. Thank you for your time. Oh.